Welcome, everyone. Thank you so much for joining us today. This is another one of Wellspring's Be Well Talks. And so, our topic today is on caring for oral side effects of cancer treatment. And so, I'd love to have the next slide to introduce our speaker for today. Perfect. So today we have with us Dr. Linda Simpson. Dr. Linda is a Manitoba-based dentist who has been in practice since 2002 with a special interest in oral cancer screening and orthodontics. Following her daughter Lila's diagnosis of osteosarcoma at age 14 in 2022, advocacy and fundraising became especially meaningful to the family. Today, Lila is cancer-free, and Linda and her family remain actively involved in cancer care initiatives. So, Dr. Linda, thank you so much for being here today with us, and I'm very excited to pass over the virtual mic to you for our presentation.
Thank you so much. And thank you to everyone for joining me today. I do appreciate that. And I appreciate your interest in this important topic. Um, I wanted to start out with my why. So, my family is what motivates me to improve and to help people and to make a difference. As mentioned, my oldest daughter, Lila, was diagnosed with osteosarcoma at the age of 14. And she inspired me at the time and still inspires me to take my dental practice in a more holistic direction. It ignited a passion of mine to do more screening for oral cancer in the dental chair and to ease the symptoms of cancer treatment. So I started learning all I could about how I could help my patients deal with cancer, its treatments, and essentially how to manage the side effects, because those can sometimes be worse than anything. And I wanted to start out with some optimism. So, according to the Canadian Cancer Society in 2024, the cancer incidence is on the decline. So it's been declining ever since 2011, with a decrease by 1.5% for men and 1.2% for women. Cancer mortality rates are also on the decline, which is fantastic. They've been decreasing between 1988 and 2021, with a 37% decrease for men and a 22% decrease for women. So this is something, it's for cancers as a whole, basically. So while oral and oropharyngeal cancers are less common than some others, they still do represent a significant health concern. And oral cancer involves everything from the throat forward. Oropharyngeal cancer includes the back of the tongue, the pharynx, which is essentially the throat, and the tonsils and the tonsillar area. There are a number of causes of oral cancer that have been identified. Mouth cancer is mostly caused by tobacco use, heavy alcohol consumption, and poor diet. And it does become exponentially greater risk if you do smoke tobacco, use tobacco, snuff, as well as being a heavy alcohol consumer. Throat cancer is mostly caused by the human papillomavirus, and I'm going to refer to that as HPV from now on. So HPV infections, that is caused by the human papillomavirus, which is the most common sexually transmitted infection. And nearly all sexually active individuals will contract it at some point in their lives, which is a pretty staggering statistic, but the majority of people will eventually contract it. In most cases, the body can actually eliminate the virus through natural immunity. Although overall cancer rates have been decreasing, so overall every cancer, they are on the decline, but the rates of oral cancer have been on the rise. And when we look at males in particular, the rise is more staggering. So in Canada, About 2/3 of HPV-related cancers happen in areas other than the cervix. So most people associate HPV with cervical cancer, but in fact, it's usually more into the oral cavity, the oral pharynx. So most of these cancers are related to high-risk HPV type 16 and 18. And HPV type 16 causes 80% of throat cancers. So these two strains have been identified as being cofactors in oropharyngeal cancer. So when cancer is found in the back of the mouth, when it's found in the back of the tongue, in the throat, it's generally caused by HPV 16 or 18. Now, periodontal health, this refers to the health of the bones and the gums in the mouth. And taking care of your oral health, especially your gum health, is an important way to decrease your chances of developing oral cancer. And I'm going to refer to the National Library of Medicine study. They did a meta-analysis of case-controlled studies in 2024, and they came up with a number of findings. They did find that most oral cancer patients had stage 4 periodontitis. And what that refers to is severe bone loss, bleeding, inflammation of the gums. So the most severe cases of gum disease and bone disease had a higher incidence of oral cancer. And the incidence of oral squamous cell carcinoma was lower among patients who didn't have gum disease and bone disease. So as dentists, we realize that periodontally compromised individuals really do need to be monitored more strictly, and especially those with any coexisting lifestyle factors. So those who drink, who consume more alcohol, and those who do smoke tobacco or use snuff. Those ones are at a higher risk. And streptococci pathogens, they've been isolated from the cervical lymph nodes, which are around the neck, in patients with oral cancer. And streptococci pathogens are prevalent in gum disease and bone disease. So there is a correlation between cancer and gum disease and the pathogens that cause the gum disease. Prevention and early detection is crucial, super, super important. Prevention would include things like the HPV vaccination, which is now a lot more common and it's offered in the schools. Additionally, education on safe lifestyle practice, which is now included in school curriculum as well. And maintaining gum health by visiting your dental professional, having regular cleanings, getting your checkups done. And then finally, cryotherapy is also a really great method for decreasing the side effects of cancer treatment. And I'll go over that a little bit more in a bit here. Early detection does include biannual dental exams and screening with the proper tools. And some offices do have special adjunct tools that can help us in screening for any abnormalities. They won't necessarily tell us if you have cancer or not, but they'll tell us, should we be referring? Is there something that we need to be monitoring more closely? So, of course, patients and their caregivers, they do face a lot of obstacles. It's not easy being away from home. Some people do have to travel long distances to seek care. They're not close to a hospital. It can be expensive to find accommodations and also expensive to leave work for extended periods of time. Parking itself in certain areas. I know in Manitoba, we do have to pay for parking. So that can really add up quickly. There are also a number of side effects from cancer treatment and from the cancer itself too, which I'm going to go over shortly as well. And of course, there's the anxiety of the diagnosis, both for the patients and for their families. Cancer therapies, they do help with treating the cancer, but they also cause a large range of oral side effects. And some of the worst ones are happening in the mouth. There is damage to not only the cancer cells from the cancer treatment, but also the healthy cells in the mouth. The cells that grow really quickly, the ones that turn over the fastest, those are the most affected by cancer treatment because they are targeted by the cancer treatment. The cells of the mouth are some of the fastest growing and replicating cells in the body. So they're greatly affected. And we do see a number of side effects in the mouth. They can be acute, meaning that they're short term. They can also be chronic, and that means that they last a long time after cancer treatment is complete. Some of them can last a lifetime. So the side effects of cancer treatment are not just present during the treatment itself. So some of the oral side effects that I'm going to go over are oral mucositis. And this one is basically inflammation of the mouth. So the soft tissues, the cheeks, the tongue, the gum tissue, the palate, sometimes the back of the throat as well. There's also dry mouth. That's a very prevalent one. A lot of people suffer from dry mouth before cancer treatment, and then the cancer treatment just compounds that. Taste changes are evident. You can become more prone to infections, tooth and gum problems, jaw stiffness, and of course, bone damage as well, which is a very, very serious outcome. So to go into these a little bit more detailed, oral mucositis, that one is painful inflammation and it can be sores in the mouth as well. They can extend down into the throat and down into the esophagus, which are incredibly hard to treat. These make eating, swallowing, speaking very, very difficult, and it does increase your risk of infection if you've got open sores, open wounds, especially in the mouth, which does have a lot of bacteria in it. So one way that you can help to combat some of this is using a lip balm that's helpful for the lips themselves, using something that's water-based or plant-based, such as lanolin. That's a good one to use, and you can get those at natural food stores. Using that is better than something with petroleum in it, because if you've got open sores and then you've got bacteria in it and you put petroleum over top, that can actually harbor the bacteria and cause more of an infection. For the painful sores, there's also different mouthwashes that you can use too. Dry mouth, that's also referred to as xerostomia. And that's damage to the salivary glands themselves, so you produce less saliva. This increases your risk of tooth decay, gum disease, and can also increase your risk of infections. The saliva can also become really thick and really stringy, and this contributes to the fact that you have difficulty swallowing and can affect your taste too. Taste changes. So with this, because our taste buds turn over so quickly, because they're fast replicators, the taste buds can be very greatly affected. Foods can taste different. Sometimes people will report a metallic taste, a bland taste, a bitter taste, or things taste very, very salty. They become really sensitive to the salt. Sometimes people can have no taste at all as well, so they can lose all that ability to taste. And this makes it very difficult to get sufficient nutrition because you don't have an appetite, you don't have much taste, you don't really feel like eating. One thing that is recommended is avoiding any commercial mouthwashes that do have alcohol in them. The reason being is that the alcohol can be really harsh and it doesn't help with the healing process either. Infections. So a weakened immune system due to cancer treatment does make patients more susceptible to all types of infections, whether they're bacterial, whether they're fungal, and the fungal infection is referred to as thrush or candida. The virus infections such as herpes can also become prevalent too. So we do want to make sure that antimicrobial therapy to treat any infections are given at the right time. Antimicrobials can cause constipation, diarrhea, digestive upset, and this is including any antibiotics, antivirals, antifungals. So we want to make sure that we're using these antimicrobials at the most opportune time because we want to provide relief to the patient, but at the same time, we don't want to affect the cancer treatment. Make sure not to use any antibiotics that were prescribed to someone else or were prescribed to you for another use, anything that's expired. It's important to confirm with your doctor prior to any medication usage and make sure that it is okay to take it, that it's not going to affect your cancer treatment, and that your immunity is good to be able to take those medications. So tooth and gum problems. This is due to a combination of dry mouth, changes in the mouth bacteria due to that dry mouth, and also discomfort from cancer therapy. This all increases our risk of tooth decay and gum disease. So lowered platelet levels due to chemotherapy as well can lead to difficulty with blood clotting, and people can notice that their gums bleed a lot more. So when your gums hurt, you don't want to brush your teeth, you don't want to floss, and this makes it even more difficult to maintain a healthy mouth. So even more important to try and find those remedies to alleviate some of those symptoms so that you're able to take care of your mouth and keep things healthy, because not only for the time when you're going through cancer treatment, but the time afterwards, you have to think about the future. Jaw stiffness. So this can happen due to surgery or radiation, especially if it is in the head and neck area. This causes the muscles and the joints of the jaw to become really stiff. And some people have a lot of trouble opening wide, which makes it difficult to eat, difficult to speak, and difficult to move around even. Chemotherapy can sometimes cause jaw pain, and spasms can be seen as well. And you can help to manage this with jaw exercises. There's heat therapy as well. Using something like a wheat bag or a hot water bottle is really helpful. Massage is good, and a physiotherapist can help with that, or a massage therapist. Medications for pain or spasms can be prescribed by the doctor. And some over-the-counter medications can be suggested by the doctor or the pharmacist also. Bone damage. So this is specifically due to radiation that targets the head and neck. It's rare, but it is very serious. It causes a breakdown of the jawbone due to a reduction in the blood supply. So some dental procedures like extractions can trigger this breakdown, and therefore they should be done a minimum of about 2 to 3 weeks before radiation. Even longer, even further in advance is better. And so it's a good idea for the dentist to assess the jaw, assess the teeth, the gums, and make sure everything is healthy prior to any sort of chemo or radiation treatments. Patients are often sent to me from their oncologist to assess their oral health prior to radiation. And I check to see if there are any conditions that could contribute to osteoradionecrosis if not dealt with early. So this could include some teeth that don't have a good prognosis. They have a big cavity, they've got infections, they've got a lot of bone loss around them. And if there's a decent risk that that tooth is going to be lost or cause further infection, it should really be extracted prior to any radiation, because we want to make sure that that bone has time to heal, and then the chances of osteoradionecrosis are much less. And this can also be something that occurs with people taking bisphosphonates. So that's something else that we like to screen for. So what to do before treatment begins? Some cancer treatments, regardless of the type of cancer that they are treating, are more detrimental to the mouth. So oncologists often require clearance from the dentist before beginning treatment, as I mentioned. So visiting the dentist to assess the health of your mouth, very important, and having your teeth clean, because this will create a healthy baseline, decrease that bacterial load so that you can fight infections and you'll have less risk of getting more infections as well. And finding oral products that are going to be helpful, something that you can use to manage any symptoms. And I actually had a patient in yesterday who is going to be starting chemo and radiation therapy very, very shortly. So she was in yesterday, she had her teeth cleaned, and we did a good checkup for her to make sure that everything was okay and she could proceed with the treatments. So, what to do during treatment? Many people don't realize that their oral health team can actually really help with relieving of the symptoms. You want to notify your team. So talk to your doctor, talk to your dentist, find out what products can be helpful, what side effects to expect, and how to deal with them. Oral hygiene. So gentle brushing, flossing, special rinses can be helpful as well, and fluoride gels too. You want to make sure that you're keeping an eye on your diet. So avoid anything that's really spicy, really acidic. Citrus foods can be difficult too. You want to choose those softer options. So staying away from things that are harder like nuts and seeds. And hydration. So sipping water often, that's really important because you're healing and you need to make sure you're taking care of yourself too. Some people can't handle the fluoride gels, so using something like a fluoride varnish is helpful. What to do after treatment? So dental care doesn't stop just because you're finished with the treatment, and the side effects don't stop either. So you want to make sure you're visiting your dentist regularly to monitor and assess any of those long-term oral side effects. Home care does continue, so you want to use those products for dry mouth as needed. And screening, continuing with the regular screening, making sure you see your dentist because you want to assess for any possible recurrences as well. The side effects of cancer treatment can last for a lifetime, so it's important to know what to do after treatment. And dry mouth especially can last for years, so finding the right products can help in the long term. Patients who are in remission. So for the first 2 years following treatment, it's important to maintain a 1 to 3 month oral recare program. And for 2 to 5 years following treatment, coming in every 3 to 6 months is really helpful. For the 5 years after treatment and beyond, a patient must be seen at least once a year, but I generally recommend biannual exams as a baseline because a lot can happen in 6 months. And again, we want to screen, we want to keep an eye on things to make sure recurrence is caught early. So xerostomia, which is dry mouth, it's really, really important to treat that because the symptoms from cancer treatment can be pretty detrimental, and it's more than a comfort issue because saliva has a lot of functions. It has many important functions. It does keep the soft tissues such as the tongue and the cheeks lubricated. It does assist in wound healing because it supplies the necessary immune cells and the markers. And this also helps to prevent infections. The oral pH is very, very specific to the mouth, and it is ideal around 7.2 to 7.0 to 7.2. However, this is only possible when you have sufficient salivary flow. Saliva also remineralizes teeth by providing calcium and phosphate, which strengthens your enamel, which is the outer part of the tooth. And saliva is the first step in food digestion because it does contain the necessary digestive enzymes. It also plays a role in taste. And when we have our foods and our beverages, if we don't have enough saliva, it can really affect the taste of those foods. So now I'm going to go into some effective management. There are some different products that are really, really helpful, and they can be used during and after the treatments. Fluoride is important. It does help to remineralize and strengthen enamel. There's xylitol, which is a sugar alcohol, and it has antimicrobial properties. Then there's citrox, which is a natural antimicrobial. Cetylpyridinium chloride, also CPC, is also antimicrobial too. There's also baking soda and saltwater rinses, and those help to buffer the pH of the mouth, and they do provide a soothing effect. So to dive a little deeper into these, fluoride, it's a great tool to help strengthen the teeth. It does prevent cavities. It is natural, and it's occurring in all of our foods, and it does occur in our bodies. Trays are an effective way to deliver the proper concentrations, and those can be provided by your dentist. And the 1.1 neutral pH sodium fluoride gel is an ideal concentration. And as I mentioned earlier, some patients, they have extreme mouth soreness, so they can benefit from a fluoride varnish that's painted on the teeth. So we'll generally start out with the fluoride trace first. If patients are having trouble after being on chemotherapy for a couple of weeks or after radiation therapy, they're starting to lose that saliva flow, then we can switch them to the varnish, which is painted on in our office. And that's something that can be done every couple of weeks. If we're looking at citrox, citrox is derived from bitter oranges, and it's known for killing 99.99% of bacteria and viruses and fungi because it does break down that biofilm, which is that film of plaque, and it does kill the plaque bacteria. It's all natural, it is organic, and choosing products again that are free of alcohol and allergens is really helpful. So the CPC, it is antibacterial, it's antifungal, and it is antiviral. It's a broad spectrum antiseptic, and it's used in a lot of mouthwashes and toothpaste to kill bacteria, and it does reduce plaque because it disrupts the cell membranes, which causes the cell death. And then, of course, there is the homemade mouth rinses, which work really well. This is a great way to neutralize the oral pH, and it does soothe mouth sores too. It's fairly simple to make. You add about a teaspoon of baking soda, a teaspoon of salt, and put that into 4 cups of water. Using warm water will help with dissolving of those products. You put it in a container with a lid, and you could keep it at room temperature. So keep it in your bathroom, keep it in your kitchen. And you want to discard it at the end of the day and make a new batch in the morning so that you've always got a nice fresh batch of it. Most people will go through a lot of it during the day anyway. You want to shake it nice and firmly, and rinse and gargle with about a tablespoon and spit it out. You can do that 2 or 3 times. And repeating that every couple of hours can be very soothing. And again, it will help to neutralize the pH of the mouth. When you don't have enough saliva, that's really key. Now, oral cryotherapy, basically, this is essentially holding ice or an ice pack in the mouth while receiving chemotherapy. It does cause blood vessels in the mouth to constrict so that the chemo drugs do not get distributed in the oral tissues at high quantities or concentrations. And this can minimize the side effects of the chemotherapy. So some people do find that really helpful. You would do it for at least 30 minutes to get the full benefit of it. Now, managing anxiety is key. It definitely helps with your overall well-being, physical well-being, and your emotional well-being. So things like relaxation and mindfulness, doing meditation can be helpful. Physical activity has been shown to improve anxiety as well as having some physical benefits, of course. Social support from friends, from families, and organizations that offer assistance to those going through cancer can be key. Massage can be helpful, acupuncture, music, art therapy, and prioritizing sleep and a healthy diet. Sleep is the time when our body regenerates and when it heals itself, so we really can't underestimate the importance of sleep. And seeking professional help can be really beneficial. Getting out there and talking to somebody who can give you that support. Now, jaw massage is very helpful for those who are receiving head and neck treatments, so radiation therapy in particular, and those receiving any sort of chemotherapy as well. They can experience that jaw stiffness or the spasms. You want to make sure that you're looking at not only the outside of the face, but you want to target muscles inside the mouth too. A massage therapist can be helpful. A physiotherapist can also be good too. Now, modifying the diet is key. You want to aim for 6 to 8 small meals and snacks throughout the day rather than the 3 big meals. The reason being is you might not have much of an appetite. Sometimes you don't have a lot of taste sensations, so it's harder to eat. And this can help to just keep things a lot more comfortable, especially if you're having troubles with digestion or constipation. You want to swap water for drinks that have calories and have protein in them. And don't be afraid to ask for help. Allowing your friends and your family to prepare meals and shop for you is really helpful. And telling them if there are certain foods that you don't think you can eat, that you can't tolerate, or that you just don't want to eat. And choosing milder foods. Anything that's not going to irritate the mouth is helpful too. It's especially important to modify the diet if your appetite is suppressed or if you've got those taste changes. And making these arrangements before your cancer treatment begins is a good way to get the systems in place. And it also helps to reduce the disruption in eating patterns too. So some recommended foods. Softer foods are good, like avocados, pudding, bananas, even baby food can be helpful. Protein-rich foods like eggs or yogurt or tofu, and those serve the purpose of being soft as well. Good whole grains like oatmeal, mashed sweet potatoes, mashed white potatoes as well, and cooking your pasta really well. Calorie-dense foods, gravies, and butters can be really helpful. And lubricating foods, so bone broths and mayonnaise, and they help to be calorie dense at the same time. Something that's nutrient dense is really good too. So smoothies, making your own, buying some meal replacement drinks from the supermarket, and then desserts and snacks. So custards, ice creams, sorbets. Those are good calorie dense things that taste good and can make you feel better. And especially if they're cold, they can be soothing for the mouth. And some of Lila's favorites, she loved peanut butter and eggs. When she didn't have much of an appetite, she was able to eat peanut butter and eggs. So she ate a lot of that. And tips for managing food intake. Nutrition is really important when you're fighting cancer, so it's crucial to make eating a comfortable experience. So as I mentioned, sauces, butters, creams to soften the foods, and using broths as well. Preparing ahead, so a blender, food processors, those can soften the foods up and make them more palatable for you. Hydration, drinking liquids such as the broths, the nutritional drinks can be helpful. Managing taste changes. So if you do have that metallic taste, using plastic utensils can be helpful. Temperature does matter. So if you do have those mouth sores, choosing colder foods are good. Popsicles are helpful. They're really soothing and they can help to numb any of those mouth sores too. Milder foods, avoiding anything acidic, anything spicy, anything crunchy. Again, sticking with those softer foods are a good idea. And water is important. Especially when you have diarrhea or vomiting, you want to drink at least 8 glasses of water a day, but more so if you're losing water quickly. Drinking milk or mild juice, nutritional drinks. That's a really great way to get some of your water in and still get some calories too. Sucking on ice chips. Again, those are soothing. And record how much you drink. That's a really nice way to keep track of things because it's easy to lose track and you want to make sure you're getting the proper hydration. So when you or someone you are caring for is going through cancer, there's a lot of resources available. So use them. You can use a dietitian. They can give you some specialized nutritional advice, a massage therapist. They can help with any of your jaw or body stiffness. Acupuncturists, they are specializing in pain management. A physiotherapist, they can help you with exercise following surgery. They can help you with massage, and they can give you some home exercises that you can do at home to try and keep your mobility. Friends and family, planning, coordinating meals, experiencing their love and support because they want to help. And if you're asking them for help, they feel really, really good. It's giving them something to do when they don't know what else they can do for you. And talking to your doctor or your dentist or both to get advice on dealing with the symptoms. There's so many resources available. Talking to your doctor to determine which options are best for you is really important too. So I wanted to thank you. Thank you all for attending today and for listening to me. I hope you took some pearls home. Thank you, of course, to Wellspring. I really appreciate this opportunity to share my experience and to try and help those around me. And thank you to everyone who is supporting those going through cancer because it's not easy and you do some wonderful work. So thank you so much.